Good afternoon, good afternoon. Hello, everybody. Hello, dear colleagues. I'm Dr. Patricio Runnacles, and I welcome you to this meeting that we are going to have today. Marcelo Alves from Brazil, talking about dental bleaching, but from a clinical perspective. Where are you right now? Chat on me, please. From which country are you right now? We are going to talk about all patients' profiles. We are going to discuss which product is better for each case. And we are going to talk about all this portfolio that FGM Dental Group has. Which are your preferred bleaching product? Yeah, do you like to perform a dental office bleaching, or you prefer more at home? Hello, Rafael. Hello, Mystic Dental from Nigeria. Felipe Fonseca from Portugal. Hello, hello. Welcome, everybody. Welcome and thank you for joining us in this channel promoted by FGM Dental Group to talk about high quality dentistry that we can spread and share on this channel. Yeah, my pleasure, Rafael, my pleasure. It's very good to receive all of you. And today we are going to have a very good evening talking about dental bleaching. And today we are going to have a very good evening. Sorry. Bahrain, welcome, Taylor Hutchinson from Bahrain. Well, I am very pleased and honored to be here as your host today in this channel promoted by FGM Dental Group. There is a Brazilian enterprise that have more than 25 years and is in more than 100 countries around the world. In this channel, we have the pleasure to receive the best colleagues in the area to talk about science, to talk about clinical experience. And today we are going to receive Marcelo Alves from Brazil. You know that FGM has a lot of products for dental bleaching, but this one in particular, last year, won the award as the best, won the award of Dental Advisor as the #1 take-home whitening. Okay, Dental Perfect. And you, what are your experience with this material? Hello, Katerina from Greece. Hello, Dental Style from Turkey, Lebanon. Very good to talk with all of you. You know that every day, more than 5,000 dental bleachings are performed with FGM products around the world. Hello, hello, Paulo Quagliato. How are you? Well, let me see. Please call your friends, share this opportunity with others to have a rich conversation today. Renata, let's go. Bring us, please, Dr. Marcelo Alves.
Yeah, we have a boss between us. Huh? Renata is our boss today.
Yeah, Renata is the backstage, and she will back up us today. How are you, Marcelo? How are you today?
Hi, Patricio. Nice talking to you right now. I'm fine, thanks. And, very excited to talk about our whitening procedures, our whitening techniques, our whitening ideas with you and with our friends from United States, Europe, Middle East, and Africa. So, I'm very pleased to receive this invitation from FGM. We have been partners for around 20 years already, and I had the chance to be you just welcomed Felipe from Portugal, and last year we were together, great friend, and we had a lot of chance to exchange ideas about whitening. So that's what we're going to do today. Thank you for hosting us tonight.
Excellent. No, thank you for accept this invitation. And moreover than products and techniques, I think that philosophy of dental bleaching is very important to discuss.
Yes, for sure. Yes, for sure. So for this hour that we are going to be together, we got to think that teeth whitening. It's something that some countries like more. Say it's a procedure that is made in countries with a larger amount, and there are some countries that do not do that much. And what's important to establish at this moment is that FGM, a Brazilian company, it's an enterprise that makes products for all over the world. And despite the country regulations or the cultures, we are ready to talk about what kind of treatment and what kind of product you might use on your day-by-day procedure if you are a dentist or if you are a dental dealer, that I think that we have some with us at this moment.
Yes, for sure. Yeah, it's very important. Well, if you are join us for the first time, subscribe yourself on FGM Dental Group International channel on YouTube. Ring the bell, and you will be you receive the next meetings that we are going to perform for sure. Well, Marcelo, if you want to start, I think we can.
Okay, I will start, and if you have any comments or any questions from the audience, because I'll not be following YouTube at this moment.
Yeah.
So
don't worry.
If you have a question, just let me know, and we'll stop the presentation, and we chat about it. All right.
Excellent.
I'm going to share my screen at this moment.
Okay.
Yeah, you can see everything. It's perfect over there.
It's coming. Yeah, it's on the screen.
All right.
If you have any questions, please do it on the chat on the side that we are going to respond to you live. Marcelo, please.
Okay. Again, thanking FGM for a company with 25 years in the market, and a very trustful company. We've been working for almost 20 years. And by the time that they asked me, Marcelo, let's talk about whitening, but not science, not only products. We want techniques. And so I went to the FGM Dental Group International channel on YouTube. So if you have any doubts on the scientific part of what we are talking, there are two chats. They were just perfect, from Professor Alessandra Reis and Professor Rodrigo Reis. They have all the scientific basis for everything that we'll be talking tonight. So let's talk about clinic. And since we're going to talk about clinic, let me tell you that most of these cases and great part of this knowledge I put on a chapter with this book of dental whitening and restorative techniques for whitening tooth from Professor Paulo Sérgio Quagliato. Patricio said, he's with us at this moment. Thank you, Professor Paulo, for inviting us. to take part in this literature. And I think pretty soon we'll have this book in Spanish, and hopefully we have in English for the whole world. So I'm very pleased to be one of the professors that took part on this book. And most of this conversation that we're going to have today, it is there. All right. So I was talking about this, that the color of the tooth will depend if it's accepted or not, of people want to change or not, will depend a lot on the culture of the country, where they come, the how is the social situation of this person. But we have to think that there are a whole amount of people that one of their dreams is to whiten their tooth. So that's what we have to think, that there are a lot of people out there that wants to have a better smile. And we have to be prepared to treat those patients. We do not have to think on to whiten or to bleach those patients. When we talk about dental whitening, we gotta think in a treatment. So we have to treat those patients, and depending on what they want from us. And since they come from a whole different amount of cultures, of dental situations, we gotta know that the response of those treatments will be individual. So we have individual clinical responses from all of those patients that we have. Since we have this situation, what is good for us to know is bleaching or dental whitening is a treatment that needs to be individualized. So what is your protocol for dental whitening? Yes, I do have a protocol. I always work with associated techniques that we're going to further on talk about it. But something that's very important is it will depend on the source of the pigments. It will depend on sensitivity. It will depend on the aging. It will depend on the time. It will depend on how can I treat this patient. So that's what we want to talk about. We need different situations for all the patients' profiles. So since we have this kind of idea, we gotta think that there are some country regulations. So since we're going to talk tonight for some countries, there are some regulations of products that they might that you might be allowed to use. So for example, here in Brazil, we can use up to hydrogen peroxide 35%. I know that in Europe, I just last year have been to Portugal and have been to Spain. Only 6% can be used. So we gotta take care on how can we work with it. So one thing is very important. Even if you have not very wide range of options for your dental treatments, for your whitening treatments, it's important for you to know what do you really have what you're allowed to work in your country. Because even if you have a shorter amount of products, or you do not have the whole range of percentages of hydrogen peroxide, you might be aware that some products are more indicated for some cases than the others. So this is very important for you to know. So since FGM is a worldwide company, and it sells for over 100 countries, we do need to respect that. And since we are respecting this, that's why I am starting this chat with you with this information. So for example, we have the same product, that's the Whiteness HP Auto Mix. We have on hydrogen peroxide 35%, and we have with 6% hydrogen peroxide. So you can tell me, Marcelo, so do you think, for example, that 6% will work? Yes, for sure it will work. So it won't be the same technique, the same time, the same number of applications that the 35%, because we have 6 times more, a higher concentration of 6 times, between 35% and 6%. So it's the same. No, it won't be the same. So we need different protocols for each kind of concentration. It's the same thing when we use home bleaching or trade technique using hydrogen peroxide. We have 6%, we have 10%. There are some countries, but that you can only use the 3%. So Marcelo, on the trade bleaching, how do you elect your peroxide to use to your patient? Well, I really prefer to use carbamide peroxide, and we'll talk about it. But there are some patients that, you know, they do not feel very good sleeping with the trays, and there are countries that the patients do not want to sleep with the trays. They even could, but it's not what they want. They want something very fast. So they want to use twice a day, in the morning and in the afternoon. So we are going to use a direct distribution of hydrogen peroxide. So White Glass will be the product that will give this hydrogen peroxide straight, because there's a difference between hydrogen peroxide and carbamide peroxide for sure. The carbamide peroxide, which is Whiteness Perfect, that Patricio was talking about being the #1 for dental advisor, and I followed that step-by-step procedure during the examination, and we are very pleased to have a product made in Brazil with this quality that was proven from dental advisor. The little difference between carbamide peroxide and hydrogen peroxide is the time of delivering. But the time of delivering, it's different. It's important for you to let you know that we have 2 important informations. First, if I deliver hydrogen peroxide in a slowly path, the possibility of hypersensitivity is lower. But if I deliver hydrogen peroxide in a fast way, using, for example, hydrogen peroxide 3% on a tray bleaching, I might have faster results, but the possibility of hypersensitivity will be higher. So what's the most important thing about this situation? To elect diagnosis. Since you do the right diagnosis for this procedure, you can choose one another. It will depend on what you want and what your patient wants to use. So this is very important, okay? With the techniques, we can start with in-office. Marcelo, do you use exclusively in-office treatment? No. I know that's important. I know there are some people that have great results with that. But in my clinic on the day-by-day, as I told you, I prefer to use or tray bleaching or associated techniques. And I will explain that why. But since we have in office, it's important to say we have many kinds of products. Even inside FGM, we have 4, even 5 with the 6% presentations of hydrogen peroxide for in-office use. We have the HP Blue, which you use 2 syringes that you mix. The advantage, as with 1 piece of syringe, you can apply the whole mouth. It's good when you're going to use on the same patient. So it's a nice product. I like it very much. One good thing about it, 40 minutes straight in contact with the tooth. So I do not need to rinse and apply another layer, as it happens with Whiteness HP Max and what happens with Whiteness HP, that they will need 3 applications of 15 minutes. One thing is very important for you to know at this time. Why do we have to change this layering? For example, 15 minutes, do I have to wash and I have to apply it again? When you talk about HP Max and HP, the greatest issue about leaving the product for the whole time for 40 minutes is because during the chemical reaction, the pH will be very low, getting an acidic pH, which will be not good for the enamel. Since it's not good for the enamel, we have to change between 15 minutes. For us, when the pH is going so down, when we exchange it, it comes back to neutral and we start all over again, which does not happen with HP Blue, and it does not happen with HP Automix. HP Automix, as well as HP Blue, will leave this pH neutral at the same level for 40 minutes. So we do not need to change either. The difference between HP and HP Blue, HP Automix and HP Blue, is the Automix point. So you use only the amount that you need. If you have patients that will need a lower amount, a smaller amount, or a greater amount of whitening product, you might use the Automix that you can control on how do you consume that. So it's very important. There are some countries that will prefer Blue. There are some countries that will prefer HP and HP Max. And there are some countries that will prefer HP Automix. Just to tell you, in Europe, since we cannot use 35%, HP Automix on 6% will be your choice. And it's going to be a great choice as well. For example, this case, only hydrogen peroxide, 35%. And this case was made by a group from the Amazon area, from the state, the Amazon, on the capital, Manaus. The team is Natalia Garcia, Rafael Tomás, Lunin Tota, Professor Luciana Mendonça, and Professor Leandro Martins, which is a great friend. And this case was signed by Professor Rafael Tomás. I took this case with me to Europe last year and the year before, just to show on how that we can get some results with 35%, okay? So initial aspect, always we need to do the cleanup of the surface, because this is something very important. We cannot do bleaching with dental plaque over our surface, that's for sure. So it's very important to remove. If we need to prevent hypersensitivity, and we are already talking about associated techniques. But Marcelo, when you associate a technique, it's not only two kinds of bleaching or two techniques of bleaching. No, I might associate, for example, the sensibilize or desensitizer agent with dental bleaching. I can associate the scrub or microabrasion with dental bleaching. I can use infiltrations with dental bleaching. So the techniques, they need to be performed in a sequence that we have to get the best results, that will get the best results. So every time, since it's a procedure that is very simple, the greatest thing about it is, since I have a nice diagnosis and I do plan my treatment, the result will be great. That's something that, you know, it doesn't depend so much on the dentist. That's why there are so many people that makes bleaching. Because, for example, if you want to do a composite veneer, you need to be trained to do that, because you need a hand to work with layering, to work with polishing, to work with the best result that you can get. But when you work with dental whitening, it's important for you to know how the product reacts and what its interaction between the product and enamel and dentin, what kind of result it would leave it to you. So we need to study and we need to get the perception on how the patients behave while we use our products. It will depend on the technique that you are used to. So this is very important for you to know. So we can work on the sensibilize KF 2% before with 10 minutes to prevent hypersensitivity. We do apply over the tooth. And after that, we can do the application of the top dam or the product that I'm going to protect the dental dam that I'm going to protect my red tissue. And here there's something that's very important for you to know. When you're going to use a barrier, how do you apply your barrier? Because there are some people that start the bleaching procedure, and what happens? The patient has pain. So we got to interrupt that. How much does it cost, this interruption? So since it costs a lot, these interruptions, let's stick with our tips. So when you're going to apply top dam, do not work on 90 degrees straight to the red tissue. Work with a 45 degree, because since I'm going to work with the 45 degree procedure, what will happen? I will put my product between the tooth or enamel and the red tissue, which will give us a better result. Sometimes you might feel that the pictures will take a little bit longer to go over between each one. Is because those pictures are with a high standard quality of photography. So, sometimes it might get a little longer to go over, but, we're going to work on that not for you to get the perception of it. So we got a nice result. Since we can lack the interaction between our dental whitening product with the red tissue, we'll have a longer lasting treatment, we'll have better results. We have safe red tissue to continue our treatment, because this is something very important. Some patients, they leave the treatment because they are in pain. And since they are in pain, we do not have the participation of this patient. And something that I told you, when you need to do a veneer, for example, composite veneer or ceramic veneer, you need your technique. But for dental whitening, we need the patient's partnership. We need the patient's collaboration. We need the patient's participation on the product, okay? To use hydrogen peroxide 35%, HP dental, FGP blue, we mix the two syringes, apply. It will stay for 40 minutes. Here's another tip that's very important. HP blue, it's highly reactive to enamel surface. So you can see that it's going to generate a lot of bubbles. That's why when you apply, you leave some product in the syringe, because you're going to mix and you're going to homogenize this dental bleaching product, and you're going to add a little bit more wherever you need. So you need to mix a lot more to loosen those bubbles of oxygen, which does not happen that much with HP Automix, because it is reactive. It gets us a nice results on bleaching, but I stay with a little bit less of bubbles. This is a picture of Professor Carlos Franci. We had the chance to be in Moscow in 2019. It was a great. We had the Brazilian Aesthetic Congress with Professor Carlos Franci and Professor Fabio Seni, which was a nice moment for us over there. And we showed this picture at that time. And Professor Carlos works a lot with HP Automix as well. So the final result on exclusively dental whitening in office with 35%, it's like this one. You could say, Marcelo, would you use a 6% hydrogen peroxide for 3 appointments, and we would get a result like this? Not that much, because we're talking about a 6 times less concentration. But there is something. I do not work with light. That's sure. We think, and most of the literature thinks that the light's not needed for that. But one of the things that has, people are studying is if you want to use light, you have to use a 6% hydrogen peroxide. And FGM has a 6% hydrogen peroxide ready for in-office use if the dentist needs to work light, needs to work with light. And this light is something important for you to say, for you to know. Some people says that light is marketing. Well, I do like to study marketing, and I really think that if you think that light is marketing, you do not know what is marketing, because we need a lot more things to keep our patients and to keep working in a safe way and a nice way. So no need to that. For example, another non-vital, we can use associated techniques with non-vital. Yes, we have two situations. We can use perborato, we can use Whitening's perborato, and we can use carbamide peroxide 37%. What do you like to use? For a long time, I have not been working with non-vital treatments. And if I need to use, I would go for 37% carbamide peroxide, because we can apply it, and for more times, perborato, I'm very concerned about. You need to seal very well the entrance of the root canal, because if you do not work on that, we might have problems. So it is a product that has been used in the world for about 40 years, but I really do prefer to work with carbamide peroxide and hydrogen peroxide within office. So I really work with in office and stay home or walking bleach using 37%. This is a case from Professor Jorge Eustáquio here in Brazil. Little girl. So you said, Marcelo, if you get a case with a little girl like this, would you go for non-vital bleaching? Yes, for sure, because we have to try to being minimally invasive. It is a difference. So this patient had a this patient had a root canal treatment, endodontics treatment made, and after that, the color of the tooth started to get a little bit dark. So what brings us this dark discoloration in this situation? Most of the time is the gutta percha that it is over the line underneath the red tissue, the gingiva, and this might happen. So we need to clean it very much. We need to seal this entrance, and then you can choose your technique. You can choose perborato, or you can choose carbamide peroxide on 37%. I'll have a tip for you for closing. This is a nice tip, because if there is a problem for every single dental professional, is when you're working with the walking bleach technique, that you need to have a provisional restoration on incisors, for example. What will happen if I have a reaction, and for sure I'll have a reaction of whitening inside the tooth? One of the products that will be liberated over this reaction is oxygen. So what will happen? I'll have an internal pressure of oxygen that it will come out from the bleaching reaction or the whitening reaction. And some people, just leave a little amount of provisional material, and there are sometimes that the patient will bite or will speak, or even not doing anything, it will fall out. Imagine that if a provisional restoration will fall, what will happen? I will have to start all over again. If I have to start all over again, I will lose one appointment. So for this kind of situation, I really like to use universal bonding, not etching. I'm going to use only the quality of the self-etching protocol for example, Amber Universal, on the edge of the restoration, not inside, just on the edge, just on enamel, light curing, and then use Opus Book Fill Flow. And you can ask me, Marcelo, why a book film for that? Because since I'm working with a very large preparation, I'm going to use the protection inside with, for example, filter paper or cotton, and I'm going to go over with my composite. And when I'm going to use my light source, I will have less contraction. So if I have dental bonding using universal, and I have a low stress flow composite, I will have a restoration or a provision of the restoration that will last longer. So I do not have to bring this patient back with us. And you can see the flowable of this material. It's very great. It's very good. So, it has a property that does not spread it very much, but it concentrates, would make it easier your work in a nice way. So we get production. And since we get production, we get better results, all right? So it's just a tip if you have trouble leaving your restoration, your provisional restoration with you, okay? So this is the result that we had in this case, that Professor Jorge had in this case. And after a while, she came for a follow-up. And with this follow-up, one of the tips for you to do on follow-up for non-vital is, make a X-ray, check how is the cervical part working on, and then after that, you can work. You do not need to remove everything. Just do the touch up with an HP automix or a carbamide hydrogen peroxide, 35%. Marcelo, I do not have 35% here. Can I use the 6%? Yes, for sure. And you can use 6% with your light, if you wish. Again, science does not prove it that you have better results using the light on your dental bleaching. But since we're talking to the whole world, it's important for you to know that if you work with light, you can work with light with Automix 6%, which is something very important for you. The follow-up after 3 years is a great result. So Jorge Eustáquio is a great professional from the state of Alagoas here in Brazil, northeastern part of Brazil, a great friend. And it's a guy that he knows a lot how to work with dental bleaching. Patricio, any questions so far?
Yes, let me, if you allowed me, let me
Sure.
make a question from Felipe Rodriguez. Does the fact that HP Blue has a stable pH cause it to generate less sensitivity in patients?
Look, not only HP Blue, but HP Automix. Both of them you can use for 40 minutes straight. Yes, it causes less sensitivity, not for the hydrogen action, but for its pH action. For example, if I have a nice diagnosis, all of our products, they can be used with less sensitivity, because I will check how is the dentin, if it's exposed or not, if it has history of hypersensitivity. So not only that, but I think the greatest advantage of HP Blue and HP Automix is the time that you spend with your patient. Yes, it can cause less sensitivity, but I do not think that this is the most important thing, because the nice diagnosis will help us to avoid it. But the less time that we stay with the patient for sure will be a great advantage of the product.
And besides that, HP Blue and HP Automix are new generations of dental bleaching. Yeah, they're alkaline products that provides better quality bleachings in dental office.
Yeah, it's something very important, because we know that FGM has an innovation DNA, for the whole life, because you gotta know that Fred, that is Dr. Frederick Schmiedestad, Fred, he is a science man, so he is the one. He is the one that works a lot with that, and he's always working on innovation. And for sure, it's a second generation of dental whitening product. And I think there are some other innovations that will come further on over there.
For sure, for sure. Okay, and another. Marina Zuplova from Moscow says, hello, Marcelo, very nice to see you. And spasibo, Marina, for joining us today.
Spasiba. Marina, she received us in Moscow for the event that we held there. And, it was a great pleasure to meet people that, work with that quality, with that organization. Moscow was a great experience, Marina. Thank you for being with us. Very pleased to have you here.
Okay, let's move on. Tray whitening.
Yeah, that's what the most of the dentists work, and a lot of the patients like. And we have a problem here that, with this kind of whitening, we have so many cases of self-medication. And self-medication with the internet is something that it's very common. But as a professional, as a dentist for almost 30 years, what is very important to say is I receive a lot of patients that come from self-treatments, not designed and not orientated and not studied by professionals. And they had problems. We could talk about the whole amount of products, but something that's very important is the tray has to be individual. So when you buy a product that you're going to put on the water and you're going to bite just to try to individual that, you're going to lose so many products because you do not stick to the right area. I'm going to explain you how to work with that. And the other thing, when you buy preloaded trays, that they are not individual, and you are going to bite over them, but the product, usually, they do not stick until, they do not go until cervical area. It has a nice diffusion, that's for sure, but I really prefer to work with a product that can leave sensitivity, controlled, only exposed to enamel surface. So that's why I really prefer to work with those products that can be used with self-designed trays or individual designed trays. For this kind of treatment, as I said before, we have the hydrogen peroxide, which delivers the hydrogen peroxide directly to the tooth, and we have the carbamide peroxide that will go through a chemical reaction, and it will deliver around 1/3 of its concentration in hydrogen peroxide. For example, if I have a 10% carbamide peroxide, it will deliver around 3% of hydrogen peroxide, a 16% around 5%. So the best thing for you to know is what do you need? You need fast treatment, you need less time of tray, or the patient prefers that. In my opinion, I really prefer to use the carbamide peroxide product. But I'm not a science revision, but it is those years of practice that brings me this opinion. But why the self-designed tray is so important? Nowadays, we really like to work with the trays, and we make our trays here over 3D printed models. So the patients do the scanning, we do the printing, and then after that we can do our trays. And the design and the right spot division between white tissue or enamel and red tissue, gingiva, it has to be protected and has to be sealed to keep our product over there. Since we like to work with that, and this kind of situation give us less sensitivity, I'm pretty sure that this kind of design with 3D printed models and good impressions in alginate, and I say good impressions with good alginate, it will help you to get the better results for your cases, for your patients. In some situations, we use only the trays. For example, 16 years old, just left from orthodontics. As you can see, this patient came to us, and the dentist, the orthodontist that just finalized the treatment said, I do not have a 12-blade burr to remove the composite or the cement of the bracket, and it used a diamond piece, and just had a big problem with this patient. Look at this enamel, and it's very difficult to repair everything. So if I will work with high concentration in a 16-year-old patient with damaged enamel and with white spots over the cervical, the possibility of problems would be so great. So since that was our situation, look at the smile of the kid. And after 2 weeks of 10% carbamide peroxide, we had a nice result, just an approximated picture. But, nice difference that we had over 2 weeks. So if the age is so, between 15 years old, we do not use high concentration. So one of the points, Marcelo, when do you use only carbamide peroxide on trays? Patients between 15 and 18 years old. I really do not bleach, I do not whiten patients under 15, and I do not use high concentration on under 18. So 14 days for a kid like this, a nice result and no sensitivity. And then after that, we are going to try to repair this enamel after the bleaching. For example, patient like this, around 29 years old, I know that if I use high concentration, I will show up a lot more those white spots. I really am concerned about white spots. And the chapter that I wrote with other, excellent professionals for Professor Spagliato's book was about white spots. And at this time, for example, we decided to use long concentration and delivering this low concentration for about 21 days. And this is what we get in the finals, a nice result. And we didn't work on this white spots. So, it just didn't come out so fast and didn't come out so white that we had to treat this dental lesion. So sometimes even over 18, and when you have white spots or we have the possibility to generate white spots, I'm pretty sure that we have the chance to use the single use. And to finalize, we go to associated whitening. But we have some cases on associated whitening. Again, another case from the team from the Amazon, and you know, a girl that, you know, I'm not going to go the step-by-step procedure, but again, HP Automix, using 3 times, 3 appointments of 40 minutes each, that, you know, you can use using the barrier. She used the 10% carbamide peroxide at home for 14 days, and look, a nice smile. We do not have to over-treat a patient like this, because if we do over-treatment on young patients, we might have sensitivity. So we got to be aware of that. Again, the team from the Amazon, Natalia, Rafael, Luni, Luciana, and Leandro, you know, I thank them. I thank a lot for them to letting me show this case of them. You know, great friends and nice results with associated technique. But let us think, this is the common way. You know, there are some cases that if we do whatever technique, it will get nice results. But there are some cases that we have to think a little bit more. And so, for example, at this case here, this case, it's a case here at the clinic from our clinic. It has about 10 years has been 10 years that we did on that. If you can get the perception, on the middle of the tooth, we have a line. So it is clear and it's whiter on the cervical and it's darker on the incisal. Most of the time, it's the opposite. So what we had to do, let's do associated technique. So we got a print, we got an impression, we got a tray. She was using the tray, but in office, what we're doing, selective areas. Only the areas that are darker. You know where you can use that? The technique you're using for canines, because if you have the incisors and you have premolars that are wider, and the canines, you know, they stick a little bit darker. What do? You go for tray bleaching or home whitening with carbamide peroxide or hydrogen peroxide. But in office, you go straight for that, for those areas that are darker. So after, you know, at this time we used the ArcFlex, that is the device that we really like to use during our in-office procedures, because, you know, it gives the patient, you know, comfort, and, you know, they can close the mouth and stick, you know, together, because you know, comfortable, because they're going to stay for 40 minutes at the time. And so we need to give the patient a good experience, because there are some cases that even if the case is good and the tooth got a nice color, so you can ask to the patient, oh no, how was the result of the treatment? Oh, the treatment was perfect. Oh, so, and how was the experience? Oh, the experience was terrible. Why? Because the dentist was late all the time, because I paid them, you know, a higher price, because I didn't feel good with the temperature inside the room, and, you know, they can complain for many things. So that's why we gotta really have to think about experience on how the patient's going to be during our techniques. And, you know, here is our outcome of the treatment using associated technique with selective areas. We had a nice result, but not always we have a good result. So, you know, I'm going to show you, this is the when the patient started. But, you know, there are some cases, for example, this case, we have just this this first picture, because this case we are working right now. And what happened, what we had the perception, look at the darker area on the scissors, on the incisal part, from the medium third to incisal third. The problem, it's not a dark tooth. The problem is value. The problem is translucency. So with translucency, we are not going to change the color. So in this case, it won't work. We have to work with composites. So since this patient is still in treatment, we're not going to show it. So by the time that this case is ready, I'm very pleased to share with you guys. All right. Another technique of whitening is the associated technique with 3 years of follow-up. And in this case, look at the white spot again. At this white spot, what we did, the patient didn't want to remove this white spot. So we went for bleaching. And if you can see, we left the area of the white spot unattended to the carbamide peroxide. Because if we use the carbamide peroxide, what will happen? When we use in-office dental bleaching, in-office dental whitening, I have a higher dehydration. And when you have dehydration over white spots, for sure, I will bring this white spot in the view. I'll have more perception of the white spot. So we left it unattended. Sometimes even we use cotton with water to leave the hydration on, and we have a nicer control. So we're not going to work on this spot. Very important, every time that you use in-office bleaching, in-office whitening techniques, you may need to use the polishing right after that. So you can use Diamond XL and you can use Diamond. Those discs, FGM, they work a lot. So again, we talk about whole solutions on the patient's profiles. That's what FGM gives us too. And for example, the follow-up after 3 years. We had 3 years after the finishing of the treatment, and so we have a white tooth, and we not have a very, very strong white spot. Patricio, again, another question?
Yes, we have here. First of all, excellent results. Congratulations.
Thank you, sir.
Well, in your opinion, how do we know when to stop the whitening treatment?
In Europe, you said. In Europe, how do we know?
In your opinion.
In my opinion, when do we need to stop the treatment? All right.
This is a philosophic answer.
Okay, yes, it's not, there is not a rule for that. But, in our opinion, what we can say, for example, Professor Jorge Perdigão from University of Minnesota, he has cases with 6 months of carbamide peroxide 10% over tetracycline cases. I saw lectures of Professor Perdigão talking about it. But on the day-by-day clinic, that's on how we live, usually 21 to 28 days of treatment. That's our average. But when we want to go a little bit further, I usually go over 40 days. Not 40 days of in-office, 40 days of low concentration. Our treatments of in-office treatments, we only use 2 appointments of in-office treatments here at our day-by-day practice, because I really prefer to use the tray bleaching, the tray whitening, and 40 days is our answer.
Excellent. A tip that I use sometimes to see if the saturation of the enamel is already done, it's compare the white of the enamel with the white of the eye. Do you use it?
No. No, not at all. But maybe can be a nice clue.
If you can return to the picture that you put with the face of the patients.
I think we might have a problem with that because
okay, it's too far.
it's yeah. But it can be a nice idea. And another thing that's important, Patricio, is the first day picture that we take. So
Yes, it's very important. It's very important
yeah,
because the patients always forgot.
that's for sure. I agree with you. The reminding ability of the patients to remember and how was the beginning of the treatment is very difficult. So one thing that's very important. So it's a tip, very it's a nice decision for you to do is do the first appointment documentation, because if you need to show something, you have the right document, and you can tell the patient with the first day picture that enough is enough. I think we have done, because they will always will work with another expectations, and they will want to continue the treatment.
Excellent.
All right.
Let's go.
So, okay, to finalize our point, we have some more pictures. First of all, tips: always do transillumination for our cases. Transillumination will show the thickness of our white spots, because they might be simple like this, they might be complex like this one here that we have at this moment. And what we're going to do with our treatment, it will depend on what is the thickness of our white spot. So we had a paper that was published in static APCD, Static Dental Magazine here in Brazil, with Professor Álvaro Junqueira, that works with us here at the clinic, and Professor Francisco Carlos, a great friend of ours. We have another paper with that, and I signed that paper with Camila Imperador Rodrigues Alves, which was my daughter. And, we were very happy to be publishing the case with her. Let me see if, okay, everything's fine here. And, for example, this case, we have a follow-up white spot. So, again, a close-up picture. Again, we did the transillumination. And we decided to use, in this case, associated technique. Whiteness perfect to 10%. And HP blue. Could be HP Automix, could be HP, or could be HP Max. No problem, all right? The most important thing, apply top them in a nice way. Just check if the bubbles are coming out. If they're coming out, we need to spread it out. We need to homogenize this gel. After finishing it, we use the polishing technique, and we use fluoride. We really like to work fluoride on the last appointment of the patient, because we have it's an expectation to tell the patient, it's done, it's over. So we are finalizing it. And since we have there are some papers that say that we have a demineralization, surface demineralization during the whitening procedure, we like to work with fluoride right after that. So the white spot right after the dental whitening procedure gets bigger. We can see it very much. Look at this case, well designed, well limited, which makes it easier for us to remove. Marcelo, wouldn't you use icon in this case, or an infiltration? No, at this case we use a removal with ultrasound tips. In this case was CVD, but today we work with a company here in Brazil that's called Healthy Dental. They have nice tips for endodontics, and they are developing tips for aesthetic procedures. The restoration, and the best thing about it is, we changed the life of this kid. He was 18 years old. Nowadays, he's a pilot, and the instant result and the follow-up after 5 years. We have stability, and this case was restored with Opalis, which is an FGM composite, and it is stable. Okay. Nowadays we have Vitra that makes our work very easier. But with Opalis, with an intermediate composite, a nice result with a nice longevity. For white spots, for example, you look at this case, you see there's no white spot there. But when you start the bleaching procedure, this white spot will come out, and the patient comes to you and says, Marcelo, look, I can see white spots, not very strong in my tooth. My tooth is not bleaching. My tooth is getting stained. So there's a difference. So that's why diagnosis will be so important for that. And if you continue use home bleaching, do not dehydrating that much, we'll get a result like this, that the white spots will disappear, not using high concentration, using low concentration. So you do not need to restore or to use any other products on that. And this case, we used an infiltration. This case is in the book. A white spot, very well localized. Only this one. So we did the procedure of the transillumination. And then look at this picture. This kind of lesion, it has edges. So we could remove. But even if we bleach it only, if we got only the treatment of whitening treatment, we should have a difference after the bleaching. So we did the study to work with Icon, which is an infiltrating product. And after the treatment, look, this is the before. So we did the bleaching. The stain got more visible. After that, we went for the treatment of one appointment. Look at there. One appointment of infiltrating technique. So let me go back here. As I told you, yes, here. So you can see that after dental whitening, we used high concentration, combined it with low concentration. After finalization, 15 days, we waited, and then we went for the infiltration technique using ICOM from the company called DMG in Germany, with this nice result. So it's almost 1 hour. I'm going to finish it, and saying thank you for all of you that were with us at this moment. But what we want cases like this to start right after the treatment, to be like this, and after 2 years, 3 years, 4 years, again, we get better results, and we can control, and the patient comes back to the office, and then we just can share the happiness of doing right diagnosis, choosing the right treatment, and having the opportunity to receive our patient back again with us. Okay, so I'm just going to say yes, just going to show you my contacts, and thank you everybody that were with us at this afternoon. It is only 1 hour, so I didn't go through many details. We could talk about many details, but I think the respect for your time that you plan to be with us, and we could give this information, and we have the contacts here, and it will be a great pleasure to answer any questions if we have. But if you do not have the question at this moment, please get in touch with us, get in contact with us, that we'll be happy to help. Okay, thank you, Patricio.
Marcelo, hello again. Well, hello. Let me do a question for you. Did you use it, whiteness RM for those white spots?
No, No, I didn't use. I use when you use RM or the technique of dental abrasion. You gotta think that most of the time the white spot needs to be very spread over enamel and with a thin layer, because if it's too deep, the white spot's too deep. That's why we really do orient. We do tell our students to use the transillumination procedure, is because if it's too dark, it's too thick, so it doesn't matter how many times you go there to spread your dental abrasion, you won't get any results, and you will turn your enamel into a very opaque surface. So if we do a lot and we do not respect the technique and we over treat with microabrasion, we lose the layering of the tooth, the natural aspects of enamel. So we gotta take care of that. Not all the cases are indicated to use microabrasion.
Excellent. And over again, we come to the correct diagnosis. Yeah.
Yep.
In your opinion, we can get the same results with low concentrations of carbamide or peroxide that comparing with the here in Brazil that we have this amount of 35%, the lower concentrations as 6% are effective as well?
It will depend the range of time that you use. Here in Brazil, we had a professor. Unfortunately, he passed away some years ago, and he was a great friend of FGM, Professor Heraldo Riel. If you talk to Fabiano Marçom and talks about Heraldo, it's almost his father. And I had the chance to be very close to Heraldo in some part of my life. I mean, even if I am a professor, if I was a professor some years ago, Heraldo was a guy that he had something to do with it. And he used to tell us, since dental whitening is a treatment, it has concentration, indication, time, and diagnosis specifically to that case. So we cannot generate which one is better. I think that if we use lower concentration for more time, for more appointments, you might get nice results. So do not expect with the same protocol, with different concentrations, the same results.
Yeah.
So that's why we have to. That's why we are really concerned about the difference of the concentrations that are allowed in the most various countries. Is that since you can work only with low concentrations, we have to explain to the dentist that don't expect fast results because the concentration is very low. So again, individual results from individual cases.
I agree with you. And I like 2 points that you highlighted that for me are very important. The gingival barrier well placed, and the tray, the vinyl tray that the patient use at home, well adapted to the tooth and gingiva, because sometimes the patients use a lot of product generating sensibility, and it's not the treatment, it's not the product, it's the amount of the product over the gingiva that is the problem, is the issue.
Yes, that's sure, because it's the same thing as the medication. If 500 milligrams is the doses for an 8-hour period, do not expect that using 1 gram you can wait 16 hours. It doesn't work like that. So the pharmacodynamics it needs the time and the right amount of percentage of concentration. So there are some patients that expect more products, better results, and we know that doesn't work. So another thing that's very important, by the time we are going to deliver the tray and the syringe to the patient, the information is over the top, needs to be over the top, because if you just handle the equipment or handle the product and do not give the information, the results might not be as good as you expect.
Let me question. You deliver whole syringes for the patient, or you do one by one?
You mean whole boxes? Whole boxes or...
Yeah, you deliver all the syringes to the patient in one time, or you deliver one?
It depends. It depends on the case. For example, today, I had a patient that I started a treatment. She's over 55 years old. The possibility of sensitivity is low, and she has a C3 shade tooth. So, but I know she's very careful. Let's say that way. I mean,
it's cooperative. It's cooperative.
Yes, but what we decided, use 2 syringes, because she's going to come back only next week. Use 2 syringes of 10%, because it depends on how you come back here. I will raise to 16, or if you do not feel good sleeping with the tray, I'll go for white class 3% or 6%. So it will depend on how it comes back. So in these cases, I prefer to use syringe by syringe. At the other hand, there are some patients that already done treatments and they want to do touch-up. And the touch-up, I will not use high concentration. Mm-hmm. And the patient that, lives far, lives in another city. So in this case, I give the whole kit, mm-hmm. and the patient comes back, because the patient already had the opportunity the experience to use this kind of treatment. So the information is well set, and the result, it doesn't need that much of alternance between the concentrations.
Excellent. And it is a very nice kit, yeah, that we have.
For sure. Yep.
Like Wolverine, the power. And this is good to work with FGM, because they have all the products and we can choose the better strategy for our patients.
Yeah, the product mix. The product mix is something that not all the companies they have. When you talk about company mix of products, you talk about range of solutions for the professional. So that's why I really think that FGM, thinking worldwide, they have the one of the best product mix on dental whitening in the world. That's why they are leader in many countries.
In countries, yeah.
Yes, and that's why I think we gotta think on that, because we need tools. We professionals, we need tools to work with our patients. So. Depending on the amount of tools that I have, I'll have better results for my patients.
Wow. Marcelo, for me, it was an honor to receive you here. Please, everybody, follow in Instagram, Dr. Marcelo Alves, to get more information with him. Marcelo, was a pleasure to talk about dental bleaching with you. Congratulations for all your cases, and I hope to see you soon.
All right. Yes, it was a great pleasure talking to you, Patricio. I really do admire your work, not only on aesthetic dentistry, but on the dental implants, that I know that you work very well on that. And, we are going through the pandemic, and we are all, apart. And we gotta think that, we are about 500 professors that are FGM friends, and most of the time we do meet at the Congress, around the Congress here in Brazil. But we're going to go through that, and we'll have the chance to chat during an event or even my lecture together, because I really do admire your work, and
Thank you very much.
It was a great pleasure to be with you and to be with FGM at this afternoon.
Thank you very much. Bye-bye.
Bye-bye. See you. Bye-bye to everybody.
Well, everybody, it was fantastic, yeah? Well, if you want to follow me in Instagram, at Patricio Runnacles, it'd be my pleasure to talk with you. Don't forget to follow at fgmdental.global and subscribe yourself here in YouTube in FGM Dental Group International to be tuned of the next meetings that we will have for sure to talk about high quality dentistry. I see you in the next meeting. Bye-bye.